Good morning everyone, this is Sexologist Dr. Uttam Dave and I welcome you to this intimate relationship video. Today I'm going to discuss a very important sexually transmitted disease which affects not only hundreds but thousands of gay and bisexual men throughout the world. So listen to this video very carefully and please follow all the preventive measures which I tell you in this video. So let's begin with a discussion of the sexually transmitted disease which is very common amongst gay and bisexual men throughout the world, which is chlamydia. Now what is chlamydia? Chlamydia is a common bacterial infection mainly transmitted through unprotected anal sex. Though chlamydia can be transmitted through oral sex and rimming, that is licking of the anus. Now as I said, that the most common activities practiced by gay and bisexual men is either anal sex, oral sex or rimming, and these become the main cause of transmission of chlamydia, which is a bacterial infection. If left untreated, it can cause serious problems, and I cannot emphasize it more that you cannot assume that you've got an infection and it's going to go away on its own. It doesn't, it never does. What are the symptoms? Often hard to diagnose as most people show no symptoms. Now this can be very dangerous. You've had unprotected sex and you've done things like maybe rimming, oral sex or anal sex, and then you don't know what is happening inside your body. However, if there are symptoms, they include a burning sensation and or a white discharge when you urinate. Now this is very important, a burning sensation. Well, sometimes it could be a urinary tract infection, which sometimes I do get because I use a public toilet. Sometimes I have myself had urinary tract infections many times because I have used public toilets, but then I kind of got through it by using less and less of public toilets and drinking more and more of water. But here we are discussing something else. A burning sensation and a white discharge when you urinate, these are telltale signs that something is wrong. A sore throat and a pain in the lower abdomen or anus. A sore throat and a pain in the lower abdomen or anus. So as you can see that these things are happening also in areas which are somewhat connected with sex. When you say about a sore throat, right, because during oral sex activity the throat is somewhere connected with the penis, and also lower abdomen or anus, that is because of like anal sex. The eyes may also become swollen if infected. Now this is also another symptom of chlamydia. What is the treatment? A swab is taken to check for infection. Chlamydia is easier to treat when spotted early. A course of antibiotics should clear up the infection. Now this is very important that you go and see a good skin specialist. You cannot go to a chemist and say, hey, I've got this problem, I've got a sore throat, or I've got pain in the lower abdomen. Just because these symptoms, you cannot just go to a normal pharmacy in India and say that I've got pain in the lower abdomen, I've got a sore throat, and then poor guy, the pharmacist over there, will not really know your sexual history and may just give you some medicine which will not help you at all. So don't try to take the help of a chemist and get it cured. It will not. Prevention. Use strong condoms and a water-based lubricant for anal sex, and a barrier for oral sex, and rimming, such as a flavored condom for oral sex, and a non-microwavable cling film for rimming. Now this is very important. Using strong condoms, you should use condoms which are specially designed for anal sex. Many of them are available in Amazon.com and places like that, or even other pharmacies throughout the world. You can order them online. And a water-based lubricant for anal sex. This is very important that after the condom is wore on the penis, a water-based lubricant be applied on it. And a barrier for oral sex. Of course, that's a normal condom. And rimming, that is a licking movement done on the anus of a man. It's very important that you put a thin film on the man's anus, and then you use your tongue in that part of the man's anatomy so that you don't get any infection. It is not advisable to share sex toys because this bacterial infection can spread through that. Avoid touching your eyes until you have washed your hands, because the infection may go over there to your eyes. It is usual for skin clinics to test for chlamydia when you have a checkup. Yes, in some of the cases, because that this is something which happens very easily, they might as well tell you to go for a test of chlamydia. So this was a brief introduction of what chlamydia is, what are its symptoms, what is the treatment, and how do you prevent it. I really wish that all those gay and bisexual men throughout the world who are very, very sexually active don't go for the treatment part. Please make sure that you prevent it in the first place. In case if you've made this mistake, then go for the treatment part. But prevention is much, much more healthier than treatment. And I wish all of you very, very happy and safe sex life. Thank you very much.